Good day, future doctors and medical technologists. Welcome back again to another episode of HIS Lecture with Mr. Neil, and I'll be your professor for today. So today we're going to talk about the last topic in our MLS 403, which is change management in health informatics. Okay, so let's start. So remember guys that changes are inevitable, especially in organizations, because they need to evolve to meet the demands of stakeholders, which includes, they can be global competitions, changes in customer demands, technological advances, and new legislation. So that's why we are going to discuss change management in health informatics today for you to be able to adapt sa changes sa in our career, especially in the healthcare system. Okay? So these are the learning outcomes for today. So to ensure there is no breach or unauthorized access of information, the HIM professionals, these are people behind making those changes possible. So let's start. So the first one is change management. These are systematic approach dealing with the transition or transformation of an organization's goal, processes, or technology. So the purpose of change management is to implement strategies for effecting change, controlling change, and helping people to adapt to change. So tatlo po yung kanyang purpose. Okay? Una is to implement strategies affecting change, controlling the change, and helping people adapt to the changes. Okay? So in line with this, there are different kinds of organizational change. Okay, so organizations may even change the way they operate in order to cope with the demands. Okay, so this might be redefining the roles, eliminating ineffective processes, or initiating new ways of working. Okay, and conversely, there are times when pressure necessitates major disruptions, which transforms the entire culture, reorganize people, processes, and systems, and change the organization strategy as a whole. So, ibig sabihin, when comes sa changes po guys in a company, there are certain things that an organization can do. So, we have these 4 general changes in our organization that may overlap. Your company may adapt these changes isa-isa or pwede sabay. Okay? So, we have operational, strategic, cultural, and political changes. So, isa-isa natin yan sila. Don't worry. Okay? So, let's start with the first one, the operational changes. Okay? So, these operational changes, can influence the way dynamic business tasks are led, including the computerization of a particular business segment. Okay? They have the highest impact on lower organizational levels that mostly affects your frontline employees. So, when you talk about operation po, since operational changes po siya, this operation is how an organization runs things inside the organization. Ibig sabihin yung pamamalakad po. Okay? While your frontline employees, which are mostly affected of these operational changes, these are people or employees that are exposed or in contact with the customer. So, example of this one is that if dati the organization is not customer oriented, with this change, they may now be customer oriented. Okay, so remember po that it is important that organizations ensure they abide by the law when caring for the safety of their employees, customers, and your assets such as the data. Okay, without consideration the legal and ethical factors, organization would open themselves up for devastating results in their current and future businesses. Okay? So, that is the operational changes. There is a change in the way yung pamamalakad po. Okay? Next thing is the strategic change. Okay? So, strategic change po is, this occurs when the business direction in relation to its vision, mission, and philosophy. Remember po, every business, every organization needs to have its vision, mission, and sometimes philosophy po. Okay? So, strategic changes happens when those things are altered. Okay? So, ibig sabihin, you need to change the strategy, Changing the business technique from business growth to increasing market share in the overall industry is a case of strategic change. Okay? For example po is, if you are selling a product that is failing, probably it's time to think of more strategies like improving the product itself. getting feedback from the customers. Oh, ano ba yung problema sa produkto natin? Okay? And then you can make the change. Or invest in advertising. Maybe the product is good but hindi lang siya nakikita, no? Hindi lang siya visible sa public. Okay? By using sponsor influencers or even change the target audience, no? Baka hindi lang talaga patok sa target audience ninyo yung produkto na binebenta ninyo. Okay? So that is one change po yun. You basically change the strategy. Okay? So another change is the cultural change. Okay? So cultural changes influence the internal organizational culture. Okay? For example, the way the business is conducted, no, such as actualizing a continuous quality improvement framework. So creating an environment where managers and workers strive to constantly improve quality. So remember po, since cultural siya, internal po siya. So ibig sabihin, it is within your organization. And changing an organization's culture is one of the most difficult leadership challenges. Kasi nakasanayan na, kasi cultural na no? That's because an organization's culture comprises an interlocking set of goals, roles, processes, values, communications, practices, attitudes, and assumptions. So your CQI po, or your Continuous Quality Improvement Framework, can also be referred, no? Pwede po siyang tawagin PQI, okay? Performance and Quality Improvement. So your Continuous Quality Improvement po can also be referred as your PQI, or your Performance and Quality Improvement. Okay, this is a process of creating an environment in which management and workers strive to constantly improve the quality. So, ibig sabihin, you want your workplace to be to constantly improve, no? So, ibig sabihin, you make a change within internal changes po yan siya. Okay? But it is very difficult because ganun sinabi ko, for example, sa SMLS department, 'di ba? Napakaraming roles po ng mga tao. Meron tayong mga faculty, meron tayong dean, associate dean, program core. Ibig sabihin, if there is gonna be a changes for the department, in this case, let's say the organization is the SMLS, okay? Yung mga nakasanayan noon, no, slowly binabago naman siya. But it needs the constant effort of everyone, not just the leader, but the leader po talaga, which is in this case, sa example natin, is the dean, needs to up yung kanyang leadership skills po, no? Kasi mahirap po na baguhin yung nakasanayan. Okay, so another change would be the fourth one, and the last one would be the political changes. Okay, so remember, political change is a normal function of internal and external politics. This occurs primarily in human resources due to political reasons of varying types. Ibig sabihin, no, lahi-lahi na reason. Rulers will be voted out, or yung mga boss natin, maybe ma-voted out sila, or they may retire, or wag naman, no, die while still in power, and a new leader will make the change. Okay, so commonly changes that happen on top patronage levels. Ibig sabihin, mga management nandiyan siya, no, mga boss, mga admins. Okay, so there are some reasons bakit magkakaroon ng political change, no? They may be voted out, retire, or die while in power. Okay, so let's ask the question, why do organizations change? Okay, so remember po, for more than 100 years, change management has been evolving, with its beginnings rooted in health and job-related group studies. So currently, most change management processes, which are designed to drive business transformations, draw their inspiration from behavioral and social sciences and IT and business solutions. So, ibig sabihin po, ito nakikita ninyo na chart, ay na table dito. These are survey over 400 senior HR managers in the US po on the reasons why organization implement our plan change. So, sabi dito, for example, 58% ng survey nila told that the organization change because there is a new performance management process na gina-implement, or pwede din there is a change in strategy. 45% sabi na because there is a change in a strategy, the organization needs to change. Or kung titignan ninyo yung meron tayong tinatawag na new IT system, which is 51%. no? Ibig sabihin, if may bago tayong IT system, the people there working needs to adapt to that new IT system. Another thing, no, I think the biggest percentage po is the second to the biggest is the relocation or facility closure. So, ibig sabihin, if there is a relocation, obviously, you need to adapt to the new environment, no? Or much worse, if there is a facility closure, you need to adapt kasi nag-close na yung facility nyo. It might be same with the COVID po, 'di ba? Some aid organizations, businesses close down and they adapt to change by doing online stuffs, 'di ba? Like for example, the SPC. From a face-to-face po, we did the online, pure online. Okay? So, yun yung mga changes, no, that the organization undergoes para at least to keep the business or the organization alive. So that's why that's why organization changes. Okay, so let's talk about so these are just example po ng mga different organization. What about the changes in health industry? So changes in healthcare industry, no, healthcare institution needs to adapt a more innovative technology to drive better patient experiences. Obviously, since we are in the healthcare industry po and we are medical technologists, remember, if you observe that our machines constantly are getting updated, getting more advanced, no? And tayo as medtech, we need to adapt to those changes. We need to know how to manipulate, operate those machines, no? Dapat dili ta ma-stuck sa old ways na to. Okay, so remember that in healthcare industry, the following are factors, no, that contribute to the changes. We have regulatory adjustments, shifts in consumer behavior patterns, and accelerated pace of IT development. So, ibig sabihin yan na nabagit ko kanina na pag may bagong system, IT system, may bagong modern na computerized na mga gamit or machines na ilagay sa hospital or sa organization, you need to really adapt to the changes. So, regulatory adjustments, these are rules and regulation, no? Or kanang it might be a change in the rules and regulation or changing your target audience or changing the technologies itself that you use. Okay, remember, healthcare consumers want a more customized experience and a greater opportunity to participate in their healthcare decisions. This means that healthcare institutions need to adopt a more innovative technology, implement an informed patient engagement strategy, and adjust the organizational structure to drive better patient experiences, which may result in numerous and rapid changes. Example of this one, guys, is during the COVID pandemic. During the COVID pandemic po, I have worked in the hospital. One of the movement or the changes in that na ginawa ng hospital namin is the drive-through na blood extraction. Kasi nga, since the COVID, because of the COVID pandemic, no, the protocols are very strict, no, hindi pwede na you can just easily walk into the hospital as walk-ins na parang wala lang. So, para malimit yung exposure po sa other patients or other mga tao, we opt or the hospital decided to make a change, and that is the drive-through blood extraction. So, drive-through jud siya, guys, no? Murag masulod sila sa hospital, meron kaming area doon na kung saan kukunan namin sila ng dugo. Drive-through lang siya. So, it is beneficial to both sa patient, no, and then as well as the hospital. Why? Because isa sa mga reason na bumababa ang, let's say for example, bumababa yung sales ng hospital natin, yung kita ng hospital, it's because wala na pasyente, because takot na silang pasok sa loob ng hospital. Madami kasing bawal, no? So, with that change po, with that drive-through na program or drive-through na activity, okay, mas madali sa patient kasi magdadrive lang sila, kukunan lang, ilabas na yung kamay sa window seat, okay, ay sa window, tapos kukunan sila ng dugo ng medtech. Hago siya sa mua as medtech, but at the same time, okay lang naman kasi malimit lang yung exposure, no? Hindi ka makaka-expose ng, hindi good mas magrabe ang exposure sa COVID. Okay? So, those changes, guys, na ginawa ng hospital namin is actually an example of regulatory adjustment. And remember po, 'di ba? I told you na kapoy siya on our end, no, as the medtech. But remember, any change can only be successful when the employees are motivated towards the change and are willing to accept the vision presented by the organization's leadership. So before they presented to us that drive through something, no, gikausap naman kami, okay? We will implement this one, but we will also increase or give incentives for every patient na makuha ninyo. So, okay lang siya. Win-win lang po siya for me. Kaya, na may kwarta. Okay? So, these are the models of change management. So, remember po that managers need to direct, control, and monitor changes to ensure that the objectives of the organizations are met. So, we have different types of model. Okay, change management process is a wide range of models, no? Itong tatlo, which is model having its own strategic approach. So, these organization which are able to manage change well, okay, ibig sabihin ma-manage nila yung change, no, well, will definitely survive and thrive. Obviously, if you can adapt to change, no, you will really survive and thrive. This is basically the concept of change management. They must ensure that the employees adapt the changes without disrupting regular operations. So, ibig sabihin, even though this is the vision, or okay, ito yung gusto na change ng inyong leader, the employees or the kanyang mga subordinates should also adapt, no, adapt to that change. Okay, and as they adapt, no, dapat the regular operation should not be disrupted. Okay, so isa-isahin ko yan sila, guys, don't worry. So let's start with the number 1, the Kurt Lewins and Freeze Change Refreeze model. Okay, so this was proposed by Kurt Lewin, the founder of Your Social Psychology. So sabi dito, no, there is a 3-step model that is constantly used since 1950s. Matagal na rin talaga. Okay, so it is still the widely used basis for many change management strategies. So ito yung tatlong step: unfreeze, change, and refreeze. So pag sinabi dito na unfreeze, it is where you create awareness on how the status quo is currently hindering the organization. Basically, sa unfreeze na part, you are making sure that your employees or your subordinates or those people who are under you is aware na kailangan ninyo ng pagbabago. Okay? Yan yung unfreeze. They know that there is need for change, and then they understand the logic behind the changes. Okay? So, ang pangalawa, since they know the meron need for change, this is the actual change po. Pangalawa is number 2 is change or the transition or moving stage. Ibig sabihin, since you already identify that there is a need for change, this is where you execute. Okay? Execute the change or implement the change that you want, no, or na-observe ninyo. Okay? And then, if na-implement na siya, na tawag yan, na okay na, then you refreeze. Ibig sabihin, this is where you reinforce, you stabilize or solidify the new state na after the change po. Okay, with positive rewards and acknowledgement. For example po, yung sa amin sa drive-thru na lang. Okay, so una, since the unfreeze is they identify that, okay, because of the pandemic and bawal, limited lang yung makakapasok sa hospital, kailangan natin pagbabago. So, they try na, okay, try natin yung drive to blood extraction. And then, pasok si change, no? We really did the drive-through blood extraction. Okay, lahat i-inform pod me as the management, ingani kung sa tong mga benefits na makuha pod namo, incentives and other. And pangatlo is the refreeze. It means, since nasimulan na siya, let's say for example for the 1 week na trial run, tuloy-tuloy na po, no? Ibig sabihin, mas pina-improve pa namin. So, dati ang kuha lang namin is dugo lang na sample, may ngana. This time, siguro, nag-improve na, no? Kasali na yung ating mga, let's say, urine specimen na kukunin, ngana. But, syempre, there is always gonna be a positive reward and acknowledgement to those people na tumulong to make those change possible. So, this model represents a very simple and practical for understanding the change process. For Lewin, the process of change entails creating the perception that a change is needed, then moving toward the new desired level of behavior, finally solidifying that new behavior as to the norm. So, ibig sabihin, up until now, okay, I don't know, since yung nakaalis ako sa MDM, hanggang sa nakaalis po ako sa MDMRC, we are still doing the drive-thru. But nowadays, since okay naman tayo, hindi naman tayo nasa COVID pandemic, the hospital, nag-change na po siya balik. Okay, another, lahi na po ilahang, hindi na, ibig sabihin, yung drive-thru something is not effective anymore because hindi naman tayo nasa era ng pandemic. Okay, so the next model, we have the ProSize ADCAR model. Okay, developed by the entrepreneur and author Jeff Hyatt in 2003. Introduced as a practical tool for ProSci, this is a company po, no, or agency, or non-change management consulting agency. Okay, so the ADCAR stands for awareness, desire, knowledge, ability, and reinforcement. Pero yan talaga yung exact na ano yun guys, sumahaba. Awareness of business reasons for change, desire to engage and participate in the change, knowledge about how to change, ability to implement change, and reinforcement to ensure change sticks. Okay, so this ADCAR model is mainly intended to be a coaching and change management tool to help and assist employees through the change process within the organization. All 5 elements of ADCAR model are sequential. So, ibig sabihin, hindi po pwede siya na mabaliktad-baliktad. Kasi nga, sequential po siya. Magkakasunod po yan. You need to be aware of the business reasons for change, no? And then, you need to have the desire to engage. And tuloy-tuloy po yan siya. Okay? So, remember, when bringing about change, it is important that everyone understands the reason for change as the natural reaction of employees to change is to resist, no? Obviously, kay nakasanayan na yung isang bagay, tapos babaguhin. This is why people need to be made aware of the need for change. The precondition for implementing change is sound and extensive knowledge. Learning new skills and steering toward a different behavior are part of this. After change has been implemented, it is necessary that this change is sustained in order to prevent a lapse into former behavior. So, kung gusto mo ng pagbabago, as much as possible, we want to avoid relapse. Kaya nga, di ba, kung sa pag-ibig, kung niloko ka na, ayaw na sa'yo, wag mo nang balikan, no? Ang uban man good naga-relapse pa. Okay? Luoy pod. Okay, next is the Kotter's change model. So, this is actually also sequential po. Magkakasunod-sunod po siya. These are 8 steps po developed by John Kotter of Harvard Business School in his book titled Leading Change, no? Which is published in 1995. So, 8 step po yan lahat. So, 8 step. Okay, kita nyo? Ladderized po siya ng 8 steps. So, ibig sabihin, yes, no? Memorizing siya kasi magkakasunod-sunod po yan. So, building a strong collaborative team by using solid strategy, creating effective communication channels, supporting staff empowerment, using a phased and steady approach, and securing the change within organization cultures are the core concept of these methods. So, ibig sabihin, if you try to understand isa-isa, yung 1 to 8 po, ano po siya, kanang step by step po siya na procedure. You need to establish a sense of urgency, creating a guiding coalition, develop a change vision. Ibig sabihin po, since tuloy-tuloy po siya na step, ang pinaka end goal po dito is that the people will go along with you, 'di ba? Kasi will go along with you kasi nga, 'di ba? If you want to adopt change, you need to invite or kanang dapat ma-persuade nimo ang other people to change as well, to go along with the changes alongside you. Okay? So, hindi pwede as the leader na kanang mo, ano lang ka na, magbago kayo, tapos ikaw pala, wala, no? So, this is 8 steps. So, out of the 3, no, you can pick any model, no? Kay Kurt Lewins, kay Prosai, or kay Kotters, any of them will still lead to a, kasi ano man din sila guys, these are just these are just models po ng change. So you don't really need to kopyahin lahat no. You can mix these changes, but syempre no, they are good the way they are. So as much as possible, again, you use only one model. Okay, but yung iba ginagamit nila is the most simple one, yung kay Kurt, this one. Kurt Lewins po, the unfreeze, change, and refreeze model. So, very easy to understand po kasi talaga. Okay din man yung ADCAR. Ang pinaka-least po na is yung kay Kotter's. Okay? Kasi 8 steps po siya. Okay? So, since we know about the change models, now let's talk about the application of change management. Okay? So, change management, these are series of tools, techniques, and processes aimed at successfully effecting change. Okay? So, research indicates that organizations implement a major change approximately once every 3 years. No? Yung major change yun, no? Once every 3 years. While smaller incremental changes happen occasionally or continually. Okay? So, change is endemic and all around us, no? So, ibig sabihin, change is constant. Organizations need to change in order to respond to the many pressures they face, no? Yung sinabi ko kanina, yung global competition, changes in customer demand, technological advances, new legislation, okay? Yun yung mga pressure nga nung nag-change ang mga organizations. So, Often, these pressures requires organization to change the way they operate, no? That's hence we have operational changes. This can include small incremental changes that redefine roles, eliminate ineffective processes, or instigate new ways of working. At other times, these pressures require a major disruption within organizations. So basically po guys, now we have lots and lots of ways to change, and it's up to us if how we identify, if we can identify na need ba natin magbago. Okay, so same with your studying po guys, no? If the way you study, if your study method is not working for you, then maybe it's time to change your study habit. Okay, so ako, before I reach my my peak study method po, study habit talaga, I have tried multiple study methods po, study habits. So hindi lahat nag-work for me hanggang sa merong isa that sticks. Yun na yung ginagamit ko ever since, no? From studying when I was third year, studying when I was in the board exam, studying for my ACPI, okay, and even when I was studying for the white belt certification in Six Sigma. So identify first if there is a need to change, and then follow up with your kanang desired na ano yung gusto mo mangyari. Okay, so let's talk about these tools, because we need these tools to have change management. Okay, so the tools are, so we have supports, no, change management tools. This supports the application, no, such as yung Six Sigma. Okay, so ipaalala niyo sa end of my name, I have this CLS SWB, or the Certified Lean Six Sigma White Belt Certification. This for laboratory managers po kasi yun siya. So may exam po yun na ganito rin talaga, parang you try to understand anong problem sa isang bagay and then try to come up with a solution. May nga po. So the Six Sigma is a set of techniques and tools for process improvement. It was introduced by an engineer, Bill Smith, while working at Motorola in 1980. So Six Sigma strategies seek to improve the quality of output of a process by identifying and removing the cause of defects and minimizing variability in manufacturing and business processes. That's why if you wanted to become a laboratory manager in the United States po, or other countries, no, it would be an edge to you if you will be if you have your Six Sigma certification. Okay, maraming levels po yan. Mayroon tayong white belt, green belt, white, yellow, green, then black, hanggang sa maging master black belt ka na. So those are paths for laboratory managers po. So nag-take lang ko, wala lang, for the char. Okay, so these are the common tools and technique used during the change initiative. So gather information, mapping of process. So if you can see, these are things that can be done, no, by people. So ibig sabihin, techniques po siya. Ibig sabihin, ang nag-operate po nito, no, technique and tools, ang nag-operate po nito are, yes po, mga tao. Okay, so these are the tools needed to initiate a change initiative. Okay, so let's start with the next one. We talk about the key performance indicator, or the KPI. So KPI po are, or the key performance indicator, these are a quantifiable measure used to evaluate the success of an organization, an employee, in meeting objective for performance. For example po, if dili natin siya i-relate sa business or sa organization, example ng key performance indicator, for example, when you do the venipuncture, the phlebotomy po. So there is a need for a performance indicator, yung parang i-check ng instructor ninyo or your professor, para makita talaga if you've done this, alam mo to, nagawa mo to, okay, para ma-evaluate ka po, because this is a quantifiable measure. Okay, quantifiable, ibig sabihin at the end, let's say for example, the highest points in phlebotomy is 30, and then you got 25. That 25 po has a corresponding meaning kung ano yun siya. It's either very good ba, no? Ibig sabihin, most of the indicators are check nga na siya. Okay, so these objectives must be placed to measure progress of change. These objectives will be measured by KPIs, no, such as these KPIs, reducing work by by X amount of percent, improving stakeholder satisfaction, reducing time to market, and so on. Okay? Remember, itong pinaka-last, having good return of investment. So, yung ROI po natin, or return of investment, this is the total cost to implement the initiative versus the total savings gained from initiative per period. Okay? So, yung key performance indicators are there to basically to evaluate, no? Or evaluate the success of an organization or the performance of an organization, its employees. And remember ha, it is quantifiable. Yung ROI naman is ito yung mga nagastos ninyo or yung inilaan ninyo na pera or effort versus sa natanggap ninyo pabalik. That is ROI, no? Return of investment. Okay? So let's move on to the next slide. Okay, now, so let's talk about the key success factors. So, remember po, these key success factors at a leadership level in healthcare organizations are needed para at least, no, you can really see the change, no? Kaya because in the world of healthcare, some hospitals are reluctant and even indignant towards the idea of change. And they find it very difficult to adjust. So, healthcare providers should welcome change and approach information technology with an open mind. So, if hindi naman sa nagano tayo, no, but there are some hospitals po, lalo na kung yung mga oldies po, yung mga tao, no, that they don't want to change talaga. Okay, mahirap po yun, no? But with change, no, by encouraging an adaptation of innovation in healthcare information technology by clinicians, therapists, nurses, physicians, medtechs, healthcare providers, they can achieve key success factors. So, itong 1 to 5, these are the key success factors at a leadership level, ha? Okay, setting the vision and strategy roadmap for the organization, forming a governing body to set direction and priorities and to allocate resources. So, this is from in admin, no, admin perspective, designating of organizations executive sponsors, departmental champions, and program manager, defining reporting requirements for the project, setting and managing users' expectations. So these are key success factors, no, sa leadership levels, because meron din tayong another key success factor, and that is for the program level, no? Key success factors at a program level in healthcare organizations. So ibig sabihin, these are kanang within na, for example, kung kanina leadership level po, that is particularly sa admin, and then the rest, no, hanggang sa rest ng mga sa admin, hanggang sa ancillary department, sa nursing department, while itong program level po, this is yung po talaga, yung sa mismong mismong area. For example, here in the ancillary department, the laboratory or ang tawag kasi sa atin is the pathology department po, ang lab under pathology. So ito po is for the key factors, success factors at the program level. So titingnan niyo po, no, there is a clear and timely dissemination of information, building a strong project leadership and other functional teams, providing proper training, no, sa inyong medtech, forming integrated teams to address and resolve complex issues, empowering staff and end user to improve the process, maintaining changes through positive reinforcement. Ang pinakalas po dito is yung number 10 po, yung pinaka-favorite ko, the other creative actions and incentives. These are high performance prizes. So ito po yung mga bagay-bagay na pwedeng gawin ng, let's say, laboratory manager natin, na kung saan para ganahan din or kanang maganahan good mag-work ang mga staff. For example, if sabihin natin na okay, let's say nakasanayan ninyo ang shifting ninyo is 6 to 2, 2 to 10 p.m., 10 p.m. to 6 a.m. Let's say yun yung nakasanayan ninyo, no? 6 to 2, 2 to 10, 10 to 6. And then there is a need to change na baguhin po yung ating standardize siya na 7 to 3, 3 to 11, 11 to 7, yung ganun. Even though 1 hour lang difference ng change na yan, guys, no? Some people find it really difficult because nakasanayan nila na 6 a.m. magpunta ng hospital, 6 a.m. dapat nasa hospital na, magasin nyo. So, pwede gawin ng laboratory manager nyo, okay, for the first month, no, kung wala kayong late, I will give, we will ask the admin na increasean or maghatag may incentive sa inyo, ha. Or, let's say you decided na magkaroon na ng monthly meeting or monthly meeting na dati every 3 months yung ginagawa, ngayon gusto niyo magkaroon ng monthly meeting, pwede gawin ng laboratory manager din ninyo na okay, for every kung kinsa ang present sa monthly meeting natin, I will be giving you, okay, meron tayong snacks, okay, magpa-pizza ko, nga na. So those are just mga na pwedeng gawin para maka-adapt sila sa change, because kung laging ganun na merong snacks every meeting, most likely gaganahan din talaga ang tao. The usual na parang once a month wala silang ginaisip na meeting, ngayon because of that, and then engaging din talaga kasi may pagkain, or let's say hindi lang pagkain, let's say merong mga incentives or whatnot, mas gaganahan ka ngayon na mag-adapt sa change na yun, no? Instead that every 3 months sa meeting, ngayon every month na ka nag-look forward na meeting, nga na siya. Okay, so these are the key success factors at a program level. Kung kanina leadership po yun, meron tayong 1 to 5. So this one is 1 to 10. Okay, so next we have working with physicians, no? So remember po, most physicians are non-hospital employees and thus must have a clear-cut adoption method for change, as different hospitals differ in their system. So ibig sabihin yung mga physicians natin, sometimes they are not sa isang hospital lang connected, no? It might be connected sa multiple different hospital, no? So ibig sabihin dapat they should have a clear-cut adoption methods, no? Kasi they need to really adapt sa change na yan, no? Kung ano yung gina-implement ng hospital na to, hospital A compare sa hospital B, dapat kabalo sila mo adapt. So si Aziz daw list some ideas for patient care and safety. So sabi dito, a physician, no, communicate patiently the benefits of change, nominate physician leaders at the start of the program, use web, community-based technology, and other multi-channel learning training, be ready and available to answer questions and clarifications, ensure availability of enhancement requests and development. So, ibig sabihin, if ever naman na mayroong mga changes po sa mismong kanang idea or kanang mga gawain or kanang ginagawa ng mga physician, no, within their hospital, kasi yung technique po nila on how they interact with the patient differs po talaga, no? Merong iba na medyo lahi jud ang way they approach, they talk to their patient, yung mga method na yan, and sometimes no, dili ta maka kung dili ta sanay makaingon ta, ay dili ko ganahan ani no doctor, di ba? That's why the physicians needs to communicate patiently the benefits of the changes in terms of patient care and safety, para at ease po si patient. Okay, so remember po, even though change is constant, no, need po na to kanang guidance, no, in order for us to adapt to change. That's why we have training and education in health informatics practices that emphasizes lifelong learning in support of change management that must be initiated by leaders. So these are certain example po talaga, no, para at least maka-adapt sa change ang ating mga subordinates, no, mga personnel natin, mga people that is under us. Okay, so dili na ko yung pagkaila guys someday, no. I really hope that all of you, my students, will become hindi lang kayo workers, no, kanang simpleng worker, but you will become leaders, no, in your own chosen fields. Okay, so maybe you may be in the hospital, in academia, because as medtech po talaga, as a pre-med natin na medtech, we have lots and lots of career paths that we can choose or go through. Okay, so ito po siya yung mga practices, emphasizes lifelong learning, no, in support of the change management. Okay, so tingnan naman natin yung mga fundamental practices that management needs to embrace as its well-rounded strategy. So these are the practices po, 1 to 9. Kung kanina we have I think 1, 2, 4, 6, 8 to 10, 12, 14, 15. We have 15. Now we have 1 to 9. So you don't need to memorize these things. Ano lang po talaga, at least be familiar with them. Okay, so let's talk about as I told you, we have different types of career paths that we can choose from, diba? So let's talk about health information profession. So health information profession provides access to and delivers important information that improves patient care and supports education, research, and publication. So health information professionals care for patients by caring for their medical data. So they are highly trained with the latest technologies and methods to improve data collection, analysis, use, storage, and privacy. So, meron tayong mga professionals din talaga na nasa health information management. So, isa-isahin natin yan sila guys, no? Titingnan natin kung ano po yan sila. So, the roles of HIM professionals, no? They have a special skill set that qualifies them to assume the role of privacy and security officers, no? Who take charge of the storage, protection, maintenance of the information in the healthcare institution. They are usually coupled with these credentials sa baba, no, such as their academic preparation. Sir, pwede po ba ako na medtech ako? Pwede po ba ako dito? Pwede po if you really want to. Okay? But, syempre guys, no, tawag yan, this health information management professional po, HM professional, is not, dili na siya kanang in line sa ato ang work as medtech. But, still, you can apply po kahit na medtech ka po, pwede ka po maging HIM professional, no? Albeit you are in the healthcare na field, okay? Healthcare nga, let's say sa hospital ka maging HIM, no? Pwede, yung iba po naman, they are medical technologists at the same time, part-time na health information management professionals. Meron po mga ganun. Okay, so HIM professionals should be committed to the timely and accurate collection and management of data, which covers the aggregation, analysis, and dissemination of patient health information. They manage the said information and medical records, administer the computer information systems, and standardize the coding systems for the diagnosis, procedures, and services provided to the patients. Such information is kept secure and private in accordance with the state laws. Obviously, alam na ninyo to, no, na if there is a data given, that data should be protected. Okay, so we have the different job categories for HIM professionals. HIM professionals may fall into various job categories with varied titles, no, including the following. Okay, so marami po, no, pwede kayo mag medtech sa gabi, medtech sa umaga, HIM professional sa gabi, or vice versa. Okay, so malaki bang sweldo dito, sir? Depende po talaga, no? Let's say for example, if you are the director of quality management, malaki talaga kasi director ka na eh. Okay, so remember din talaga po that if you wanted to become part of the HIM professionals, no, career in health information management and health information technology is not limited to data capture, documentation, and maintenance of clinical information. Di lang doon. But it also includes data analytics and interpretation and management of health information technology systems. So, it would be beneficial for you as a medtech to be employed in a healthcare na field, because you have a general idea of unsa ni sila ng mga sakit, unsa ni sila ng mga laboratory tests, 'di ba? Mas madali sa imuha to interpret those things. Okay? These professionals also ensure that the patient is billed correctly and assure that accumulated healthcare information is compiled and analyzed to assist in making recommendations that improve the health services. They are also expected to devise policies that address concern on the delivery of high quality healthcare and the availability of quality information for decision making. So usually this is yung sa pinakalas na part po, yung mag-devise sa mga policies. This is the job for the director of quality management. So, no, what if someday you will become the health information management department director? Kuya, no? So health or manager. Okay, so there are lots of things, or ikaw yung magiging health information administrator, admin, Zai. Diba? So, there are lots of things or career path that we can take po as a medical technologist, no? Kasi nga, we are in healthcare field, so that's why, malay nyo, someday kayo, no? I really hope that all of you will become leaders, no, in your own respective fields. Okay? So, let's talk about the ASEAN regional information and communication technology advancement. So with the increasing popularity of smartphones, wireless tools, and other comparable technology, primary care and specialist referral services, as well as the remote patient monitoring and patient medical health information, are undeniably improved with the help of medicine. So obviously guys, nowadays, no, we can seek pwede tayo magpakonsulta online, di ba? No? Even though the doctor is in Luzon, we can really ask for a prescription. Ingana. Okay, because that is yung ginusto or the movement, no, done by the advancement of the technology. So, in Thailand, Singapore, and Malaysia, they have started adopting healthcare IT solutions to bring the sector to the next level. So, sabi dito, in 2009, Singapore developed its National Electronic Health Record Initiative. Alam na ninyo ang EHR, no? Which permitted healthcare practitioners in the country to access patients' records across healthcare continuum. Ibig sabihin, even though malayo si doc, makita niya na yung kanyang EHR or makita ni patient ang kanyang EHR. Malaysia also initiated the hospital implementation system in 1993 with its first telemedicine project in 1996. Way back 1996 ang telemedicine sa Malaysia. And Thailand creates its National Information Committee in 2010. So, ibig sabihin, these are just advancements in technology. Sa Pilipinas, meron din po tayo. And that is yung tinatawag natin na e-health strategic framework and plan for 2014 to 2020. Philippine Health Information Profession. So, the Philippine e-health strategic framework and plan is the result of comprehending what the Philippines needs to achieve in order to address its health goals and challenges. So, the objective of this one is to utilize the information and communication technologies in the health sector. The goals of this one is to establish unified, coherent health and management system. Management information system. Take advantage of ICT to reach and provide better health services. And then, because of this Philippine Health Information Profession or ito yung ating tinatawag na Philippine E-Health Strategic Framework and Plan, no, or the PEHSFP, okay, na it needs to support the UN Sustainable Development Goals. Okay, so meron talaga because of this one, itong e-health na to, kaya nagkaroon po tayo ng telemedicine sa Pilipinas. Okay, kaya tayo nagkaroon ng telemedicine. So kung sa other countries, no, sa Malaysia 1993 pa sila nagkaroon ng telemedicine, no. Ang Pilipinas is mga 2000s na po. Okay? So, ano nga ba yung telemedicine na sinasabi ko? And this is yung ating the use of electronic communications to transmit and exchange medical information and data to provide patient treatment. An example of this is, I don't know if you are familiar with, during pandemic, nag-boom talaga yung mga konsulta MD, yung mga ganun good, yung mga bodyworks, nga na. So, ano yun sila guys? No? Those are tawag yan, telemedicine po sa Pilipinas. Advancement yan po siya because web-based naman siya. Okay, so you can do it online, no? Meron silang app, mag-subscribe ka lang, and then meron kang ilang price of video call sa mga physicians. Dili na nimo need na magbayad 500 because the subscription nimo is enough, no, na makapangayo o prescription sa ilaha. Okay, so let's check, no? One of the outcomes of this e-health, yung kanina na framework, is the birth of telemedicine in the Philippines. So, dili na to pagkaila that Philippines as an archipelago is very, very katag-katag ang mga islands, no? So, because of the telemedicine, no, within the region, okay, nagiging ano na siya, na it transforms the Philippines into a kahit na sa mga nasa rural area ka nakatira, no, you can have access po sa mga physician, no. Hindi na nimo need naman what if yung patient hindi talaga makalakad, no, tapos kailangan niya ng prescription sa antibiotic or what not. So mas madali na lang siya, di ba? From electronic patient records, no, to the wireless transmittal of patient files and remote diagnosis, improvement in communication, no, will really lead the way to better delivery of healthcare services. So these healthcare services are made possible because of this telemedicine. So, we have the overview of the achievements of this one. So, we have, ito yung sinasabi ko po, no, meron tayong My Pocket Doctor, My Doc Now, the Medway Healthcare Inc., and yung Bodyworks. Okay? So, ito po sila, these are multiple players in telemedicine nga scene currently existing in the Philippines, ranging from the use of mobile app or yung ating call center services. Okay, so yan po yung mga example natin. Meron din tinatawag na prescription box, no, or yung RX box, diagnostic telemedicine device. Okay, so The RX box diagnostic telemedicine device was incorporated in the government telehealth program through the OST's support. The first version in 2007 was developed by Dr. Alvin Marcelo and Dr. Luis Sison. Okay? So, si Dr. Marcelo po is a trauma surgeon that envisions that prescription box or RX box would use in ambulances transmitting a patient's clinical parameters via telehealth to prepare better the emergency room clinicians to receive this critical patient. So, ibig sabihin, gusto niya that while you are traveling po, let's say for example, nasa ambulance yung patient, no, while the patient is still in the ambulance, no, masasend na yung data kung ano po yung mga nangyari sa kanya. Okay? Para at least yung mag-receive po ng mga doctor sa receiving end, sa OR, ER, or sa hospital, no, they are fully aware on what to do. Nagets po ninyo? So, yun po yung gusto niya. No? Dr. Season continued the development of the second version beginning in 2012, and this time with Dr. Portia Fernandez Marcelo, they envisioned it to use in rural health units. So the clinical data gathered by the prescription box is exchanged with the cheats, no, the cheats o yung ating community health information tracking system, no, electronic medical record systems. In the event of clinical dilemma, data can be pulled from cheats and transmitted for specialists for teleconsultation. So ibig sabihin, aside from magkakaroon na ng idea yung ating mga doctors sa receiving end ng hospital, the data gathered or the data input po will be stored, no, will be stored and can easily be checked. Let's say for example, the patient is needed to be referred to a professional or specialist, mabilis na lang yung data. Okay, so in the latter part of 2018, the seamlessly linked systems of RX box, cheats, and telehealth will be implemented in 1,000 rural municipalities and with medical specialists in all regions nationwide. So, ibig sabihin, very, very, maganda talaga yung nagawa ng telemedicine po para sa atin. Ibig sabihin, even those areas na wala, like for example, sa lugar namin, sa Calamansig, Sultan Kudarat, wala namang tertiary hospital dun. Wala nga kaming, may mga doctors naman, pero 10 kilometers away pa. So, if my parents want, even though may mga pharmacies doon, they will not release antibiotics naman, di ba? So, without prescription. So, ibig sabihin, need ng parents ko talaga na magpunta pa 10 kilometers away dun sa place para lang makapag-pareseta ng antibiotics. So, with the help of telemedicine, no, mas napagaan po yung life ng parents ko. And then, meron na rin silang, AHR record na nakastore sa cheats. Okay? So, I hope you learned something today, and that would be the final lesson for MLS 403. So, thank you so much for listening. Have a great day. Bye-bye.